I'm Sergeant Mitchell with the U.S. Army Medical Department Recruiting. This video, we're going to have a little bit of some real talk, okay? So I'm going to ask you guys a few questions. Just ask yourself this. Why do you want to become a health professional, a healthcare professional? Why? I'm pausing so you can think this through, okay? So many individuals go into the health professions in order to heal, treat, and save lives, right? That's why we do it. Individuals entering this field have a sense of wanting to give more, right? Wanting to give themselves to a greater cause, a higher cause. What's higher than the U.S. Army? So, but they're a little bit torn. They're a little bit afraid. Many individuals say, well, I don't want to deploy. I want to go overseas. I'm going to ask you this question. Does it matter who your patient is? Does it matter if they can pay or if they have health insurance? Does it matter where they are? The biggest question is, does it matter? So if in the core of you that answer is no, then I'm going to challenge you with more questions. Okay? Let's say you have a patient that is in the desert, and the only way they will be able to survive is if you administer treatment to them. Are you willing to treat that patient that may be in the desert? Many of you are like, yeah, yes, why not? Okay, cool. So I'm going to ask you another question. Are you willing to take a convoy to treat that patient that's in the desert? Many of you are once again saying, yeah. So for those who are saying yeah, I'm going to ask more questions. Now, once you take that convoy, you got to take the convoy to get to the plane. That plane's going to bring you to your patient that's in the desert. Are you still willing to treat this patient? I'm sure you're saying yeah. So now you're on the plane. But the only way to land to get to that patient is to jump. I know the stakes are getting higher here, okay? So are you still willing to treat that patient? Many of you guys are saying, yes, Sergeant Mitchell, yes, I'm going to treat this patient. And that's what I like to hear. So now you jumped out the plane. And you're going to get to your patient. But unfortunately, the only thing you have is a pen and maybe a Ziploc bag. And I'm going to make it a little bit easier on you. I'm going to give you some tape. Can you still treat that patient? Many of you are still saying yes. Because you know how to treat. And let's say that that patient have injuries such as collapsing lung or open abdominal wound, that's what you're going to need to treat. Are you still willing to treat that patient? Many of you are still saying yes. And I like that. Now, we treated the patient. Now, the only way they're going to get on that plane is if you carry them. Are you still in this? Do you still want to treat? Many of you are still saying yes. Okay? Now, you're in the desert, but they didn't really have a brick and mortar hospital. They were functioning at a tent in which you built. Are you still willing to treat this patient? Are you still willing to do what's necessary in order for this patient to survive? Many of you have said yes, I know. I know. So then my next question is, why are you afraid of a deployment when what I just described is pretty much what you're going to be doing? Okay? It's all about treating by any means necessary. That is what you're going to be trained to do. So you already have the skills of being a health professional. Okay? We got the skills. But do you have the skills of being a soldier in order to do and treat your patients by any means necessary? That's what this is all about. Okay? We're not going to fall into that just category where we're just a nurse, where we're just a doctor, where we're just a physical therapist. Well, we're not just anything. Because once you get in these boots, you're going to be everything. Are you willing to do that? And if that is answered with a compassionate, a passionate, just a yes, then you may have what it takes. You may have what it takes to compete. Now, we do know that the journey to becoming a healthcare professional is not easy. Many nights are spent studying. Many engagements are missed. It's hard. But because it's hard, the Army wants to reward you and take some of that stress off of you by covering your tuition 100% to any school in the United States. Okay? And territories. So that's what it's all about. I'm not going to say, hey, take this money. No, because not everybody is capable of doing that. They have big hearts. Big hearts, but unfortunately they got like Kool-Aid for their blood. They might not have it. Oh, they might have tiny heart syndrome. I don't think you do though. So that's what it's all about. You're going to work hard and you're going to get rewarded greatly. Okay, but you got to put in that time. You got to make right decisions. You got to be focused all the way through med school, all the way through until you reach your goal. You will be rewarded. So, are you ready? Do you have what it takes to become an Army medical officer? Think about that. Best wishes to you on your journey. Okay, we're here for you.